Tuamini na tuombe. Mfalme, katika jina la Yesu tunakushukuru, tunakuhimidi, maana wewe ni Ebeneza. Umekuwa nasi usiku wote, tunaona jua lako likichomoza, tunasema ni asante. Yesu wangu, tazama gavana pamoja na mawaziri wake pamoja na watu wa Kemsa wamekuja ni kwa ajili Bwana ya kupeana madawa katika zahanati zetu na mahospitali. Twakabidhi mikononi mwako. Mfalme wa ajabu, anapozindua hii madawa ikienda katika hospitali kufanya kazi, wacha mwana wa amani akawaongoze. Yesu wangu, watu wako wanapoenda kutumia hizi madawa, wacha wakapokea uponyaji. Tunamwombea gavana, kila kazi anayoitenda Bwana, wacha ukuu wako ukaonekane katika maisha yake. Tenda ishara na maagizo katika maisha yake, maana wewe ni mwema. Asante maana unaenda kumuinua. Ni kwa Yesu nimeomba na hata kuamini. Amen.
Asante sana, Your Excellency the Governor, our CS, the Kemsa team, our CCMs around, chief officers, directors, county pharmacists. Good morning. We are gathered here very briefly for the flagging off of the drugs, and we don't want to take so much time. And at this juncture, with your permission, Your Excellency, let me invite the county pharmacist to lead us. Karibu.
Thank you, Your Excellency, our Governor, the members of the Cabinet, our CCM, COH, County Secretary, our Director, and members of the public. Today, I'm delighted that we are receiving a consignment of drugs from Kemsa, and therefore I want to thank Kemsa for remembering us just when the El Nino rains are approaching. So the drugs we are launching today will go to all the 75 health facilities via the last mile delivery model. So the consignment today is worth 42 million, and therefore I would like to urge our health workers to rationally use the commodities, account for every tablet or ampule to the benefit of our patients. So I would like to invite our director to take over.
Your Excellency the Governor, the CCs present, the County Secretary, and all other guests, thank you so much for giving me this opportunity. Your Excellency, this is so exciting. I feel like just going back to the field and being a witness, because most facilities will be excited, and we are hoping that these drugs can at least take us through the rainy season, and at least if there is any surge, we'll be able to contain it. We thank you again so much, and we thank your leadership for having enabled this to happen, and we hope that the next time we'll have it better and bigger, but this is so good. I'm just too excited about it. Thank you so much. Let me invite the Chief Officer.
Thank you, Your Excellency the Governor, the County Secretary, the CCMs present, representative from Kemsa, and all present. This is a very good day for us as a department. We've had complaints before that we do not have drugs, and we want to appreciate Kemsa that you have responded very fast. But then a message to our people of Vihiga, haya madawa hayatakuwa kwa muda mrefu sana. Sasa tutafanyaje ili tuendelee kuwa na madawa katika hospitali zetu? Ni jukumu la kila mmoja wetu ajisajili na NHIF. Na wakati unajisajili na NHIF, ukichagua facilities zetu, utatibiwa, utapata haya madawa. Lakini hizo hela ungelipa hapo, NHIF itaturudishia. Ili wakati haya madawa yanaanza kupungua, our facilities are able kupata madawa mengine kwa haraka, so that we have a continuous supply. Sasa ni jukumu letu sisi kama wanavihiga, tunapoenda kwa hospitali, kumbuke kujisajili na NHIF ili tupokee malipo kutoka kwa hizo. Kwa hivyo sitachukua muda, wacha nimwalike waziri wa idara achukue ushukani.
Thank you so much, Chief, Your Excellency the Governor, our Kemsa, our County Secretary, my colleague CCs, Director, and all protocol observed. Good morning. Personally, I'm happy to have this day, a day whereby the county, as a county and a department, we are able to bring commodities, important commodities for our people in Vihiga County, because actually we cannot manage curative diseases areas without commodities. Many of our facilities have done fairly well in terms of managing them, and we had started receiving stockouts. Now with these commodities coming in, I want to ask all the in charges and our health workers prudently for where they're supposed to go to. For our people of Wilber County, we are lucky as a county. We're among the few counties that have received. And I want to thank Sylvia, thank you, and the CEO, Dr. Mulwa. I'm grateful because they have processed our consignment very fast. I think ours was the second after third after two other counties that had come earlier, but we have done it and they're here with us worth it for 2 million. 8 lorries, up from last time we had 7 lorries. Now we have got 8 of them. So all the 75 facilities have now commodities. And our people, when you go to the facilities, have what you call the third eye, oversight as a community, to be able to see how the drugs are being used down there, then be able to positively help us know how to manage and monitor so that there's value for money. Indeed, we have also moved higher that by having now, last time we had only health in charge, community health facility in charges receiving the commodities. This time around we have got receiving and accepted committees that will include members of the staff of the facility and also members of the boards or community committees, so that we see what they have received and they'll be able to monitor how long they're using it. In this calendar year, Wilber County, I want to thank the governor. We've been able to have these commodities come 3 times. This is the 3rd time. In February we had them, in May we had, now this is September, we are having it. So an interval about 3 to 4 months, we have another consignment coming. It's not easy for a county that has got no plan, but with our governor here, we want to appreciate and thank him for the assistance he has given us as a department that we are able to have this. I also want to thank the Department of Finance, which have worked closely with us when it comes to payments. As we process our payment documents, they are able to process very fast and we have the drugs. Because of time, I want to appreciate the presence of my colleagues. Dr. Kitongolo is here. He is quickly becoming a doctor. We want to wish you well. CEC for Agriculture. We have Honorable Mulongo is with us here. CEO Sylvester, thank you. Let me take the opportunity to give the County Secretary to, maybe before the County Secretary, you'll be able to bring in the Kemsa. Thank you.
Thank you so much, Waziri, Your Excellence, our Governor, the CM present, our officers and a team from Kemsa, our health team, ladies and gentlemen, good morning. Your Excellency, it's a wonderful morning, and we want to thank you for your leadership, and indeed, in your manifesto and your CIDP, issues of health, Your Excellence, is a priority. And it's not just on paper, we can see it practically. So we want to thank you, Your Excellence, for what you are doing for us. I'll not take much time because of the very busy schedule. I equally just want to thank all the CCM present, all the directors, everybody present. Thank you so much. God bless you. Just one thing, Your Excellence, before I request our lead team from Kemsa to talk to us. Sometimes back, about 2 years or 3 years ago, wherever we got these drugs, we could complain about, disappearance, maybe misuse. But Your Excellence, for the last 1 year or so, I want to report that we are doing very well. It's like the drugs are being used very well, and our people are very happy. And people who have drugs and they are being treated and their health is good, then it's a happy nation and it's a happy county. So we are very grateful. And at this point, I wish to call our lead team from Kemsa to talk to us. Then we shall request you to bless us. Welcome.
Thank you, County Secretary. Your Excellency, the Governor, CC present, Chief Officer, Directors, all protocols observed. Good morning. My name is Sylvia Munyasi, Regional Sales and Marketing Executive, Kemsa. Your Excellency, first and foremost, I want to take this opportunity to thank Vihiga County for the cordial relationship and partnership that we have enjoyed as Kemsa over the years. I'm also privileged to be here today to witness the flag of HPTs from Kemsa. These commodities are worth 42 million. They contain pharmaceuticals and non-pharmaceuticals. These commodities are going to be distributed to the 75 facilities in this county. Your Excellency, as Kemsa, we just want to assure you of our commitment in supporting Vihiga County. I commend you for the good work and the efforts that you are putting in place to ensure that the citizen of Vihiga County access quality healthcare in accordance with your manifesto. I also want to take this opportunity to just say, Your Excellency, that you are one governor who has been very consistent in the procurement of HPTs. As we always say, service to humanity is like service to God. Thank you very much, and God bless you all.
Thank you so much. Service to humanity is service to God. Thank you so much. Ladies and gentlemen, allow me to, I wish that you join me in welcoming His Excellency so that I can speak to us and bless this day. Your Excellency.
Good morning, everybody. This is another very important morning when we are gathered here to receive drugs from Kemsa for the health and welfare of our people of Vihiga County. I wish to take the first opportunity to thank the Health Services Department for the excellent work they are doing to ensure that our people get quality health services. Second, I want to thank Kemsa, who are our close partner, for working very diligently with us to ensure that health commodities or drugs are availed to our health facilities. We have had a very good, cordial working relationship with since I assumed the position of a governor in 2019 when we signed an agreement of partnership and cooperation. And I want to report that we have worked very well with Kemsa for all those years I have been in this county as the chief executive. And I want to assure Kemsa that we are committed to work together with them to ensure that we continually receive health commodities and ensure that our people have access to these commodities when required. I want to thank also our health workers in various health facilities in the county for the great job they are doing to ensure that our people receive the health care services that they require anytime they go to those health facilities. I also want to note with appreciation that since we started this program in 2019, we have seen tremendous improvement in how the drugs are used in our health facilities. We have seen a very improved accountability and transparency in the distribution of these drugs and other non-pharmaceutical materials. So I want to note that with a lot of appreciation. However, we may have a few facilities where the leaderships are not yet in line with what we expect of them. And it's for this reason we have decided to become even more transparent by ensuring that for every health facility where these drugs are going to go, we have now formed a committee which is going to receive the drugs and be able to confirm and certify the quantities and the types. And after they receive, they will regularly monitor the usage of these commodities. This is going to ensure that if there is any one or two people who may be bent to misuse the drugs, they don't do it. So I want to ask the committees that have been formed in all the 75 health facilities to ensure that these drugs are used by the people of Vihiga, and there should be no stealing or no leakage to other health facilities. I also want to echo the issue that has been raised by the chief officer, in that our people in Vihiga, we need you to register with the NHIF so that you can access to services in our health facilities without having to pay. We as a country and as a county, we are committed to universal health coverage. And you even saw yesterday in Nairobi, we were with the president issuing out how we are going to empower our community health promoters to ensure that we achieve the universal health coverage. And therefore, we expect all Kenyans to be registered with NHIF. And the government is in the process of restructuring NHIF. We already have bills in Parliament that are going to restructure on how our health services are going to be delivered in this country to achieve the universal health coverage. And therefore, it is the responsibility of everybody to register with the NHIF. So we want to move away from this issue of Harambes. When somebody gets sick to pay bills, this should be something of the past. We want each family to have an insurance so that any member of the family, once he or she is sick, should just go to the nearest health facilities with your card. You are treated, and in the process, once you are treated without any payment, the NHIF will reimburse our health facilities. And we have also we have a law, Facility Improvement Fund, which then allows us that money to go to those health facilities. And in that way, we would make our health facilities self-reliant, and they will be able to have enough money at any given time to purchase drugs when needed. So I want to appeal on our people in Vihiga, please register with NHIF, and particularly our youth in our border industry, because sometimes when they have accidents, they are very fatal and it's very, very expensive, the health insurance. So let's have the insurance announcing on how the people with the insurance can be covered by this program, and assure the people of Vihiga that as a government, we are committed to ensure that we deliver services to the people, and particularly in the health sector and other sectors. I also want to caution our people that as we move towards the El Nino period, people must be vigilant, people must be very careful, because with a lot of rain, those of us who are there in 1997, you know what happened during El Nino. There was so much rain that everything was disturbed. So let us prepare earlier. Those of us who stay in high areas, in hilly areas, you have to prepare to move. And we are to deal with El Nino, and very soon we shall be advising you some of the areas that are highly vulnerable to disasters, and we may ask those in those areas to move. So when we do that, I hope we shall have the cooperation that is required. But also with El Nino, we expect a lot of emergency of many diseases, particularly diarrheal diseases, respiratory diseases are likely to come with a lot of rain and a lot of water everywhere. So I want to appeal to our people to prepare and keep very high hygienic practices to ensure that we do not have spread of diseases that are waterborne, particularly diarrhea, typhoid, and other diseases. So with that, I want to say thank you very much, and it's now my time to flag these drugs to go to their respective health facilities. Thank you and God bless.
Your Excellency, with your permission, I'd like you to approach the Kemsa pickup for verification and sampling of some of the drugs before the flagging off. The county pharmacist will lead in the maybe explaining the drugs that are on the pickup.
Yes, so Your Excellency and honorable members of Vihiga County, here we have a few commodities that we've just sampled to show us what we are receiving. So first of all, here we have you can see it's branded Kemsa, metronidazole, kwa shida ya tumbo, wale ambao, yes. Tumbo. Yes, those who have stomachache, maybe wanaendesha, you can use for 5 days, then they get better. Then also for those who have diarrheal diseases, this is zinc ORS, Copac, inatumika na watoto na pia na watu wazima to rehydrate the body so that they are not dehydrated. And yes, our most common paracetamol for pain and fever. This is what all facilities are going to get. Also, we have some drug here called promazine kwa wale ambao wako na shida ya mawazo. Yes. It's an antidepressant. Yes. So zile wako depressed anatumia hii dawa alafu anapata nafuu. So pia kuna brufen syrup. So hiyo ni baadhi ya madawa ambayo tumepata. So in total we have 8 lorries here that will go to all our facilities. So thank you so much, Your Excellency, for the support we have received so far to ensure that our facilities have a constant supply of drugs. Thank you.
Thank you.
Okay, the officer with the flag, prepare to hand over the flag to the governor. So His Excellency the Governor will flag off the drugs, starting with the pickup.
Now it is my pleasure to 75 health facilities in the county.
Wapi makofi ya governor. Asante sana, Your Excellency.
Mwananchi mzalendo, kwa uchungu na mateso, kwa vilio na huzuni, tulinyakuliwa uhuru na mashujaa wa zamani, hawakushtushwa na
Halo, tusichoke kupiga makofi tafadhali. Our role is just to clap.
Nia yao ukombozi, kuvunja pingu za ukoloni. Naishi na tumaini, najitolea daima Kenya. Hakika ya bendera ni uthabiti wangu, nyeusi ya wananchi na nyekundu ni ya damu.
Tuendelee kumshangilia gavana anapozindua haya madawa.
Amani daima mimi Mkenya.
Haya, hiyo ndio lori ya 8. Asante sana, Your Excellency. Zinasindikishwa na pickup ingine ambayo ni ya Kemsa. Asante sana, Your Excellency the Governor, kwa hiyo hafla fupi.
Kutoka ziwa mpaka pwani, kaskazini